Hi everyone, my name is Sarah Bryce and I will be explaining polycystic kidney disease, also known as PKD. So this is a kidney disease characterized by cysts that accumulate on the kidneys, and these are non-cancerous and they are filled with a water-like fluid. So these can actually accumulate to be really big. They can grow up to the size of a grapefruit, which is really crazy if you consider just how small a kidney is. One of the cysts on the kidney can be bigger than the kidney itself, which is absolutely crazy. And about 600,000 people currently have PKD in the US today. Fortunately, I'm one of them. But it's a slow progressing disease, and most people don't find out until they're between the ages of 30 and 60 years old. Some people don't even find out they have it until they're in their 70s or 80s. So it definitely doesn't affect you until later in life. But I will explain the symptoms and implications of the disease in further videos. I just wanted to spend time on the genetic nature of the disease in this video. So this disease is spread equally amongst men and women, and it's distributed evenly across ethnicities and races, but it is highly genetic. So there are three types of PKD. There is autosomal dominant PKD, which affects the majority of people with PKD, and there's autosomal recessive PKD, and then there's PKD as the result of a spontaneous mutation. So again, like I said, autosomal dominant PKD is the most common type. It has a dominant pattern of inheritance. So if one of your parents has PKD, you have a 50% chance of inheriting it. And that goes the same for your kids. If you have PKD, your kids have a 50% chance of having the disease. And there are two genes responsible for autosomal dominant PKD, and that is the PKD1 gene and the PKD2 gene. The PKD1 gene is responsible for 85% of the population with AD PKD, and the PKD2 gene is responsible for 15% of the AD PKD population. So there aren't serious implications to which gene you're affected by, except for some recent studies indicate that people with autosomal dominant PKD that are affected by the PKD2 gene may experience slower progressing symptoms and less severe symptoms. So this may possibly be the more gentle form of autosomal dominant PKD, but they're still working on research on this. So, and this in general, it's kind of a rare disease, so there's still a ton of research in the works. So they're definitely working on that. And now to explain autosomal recessive PKD. This means that if two parents are a carrier, they don't experience the disease itself, but they're carriers of the disease, then their offspring has a 1 in 4 chance, 25% chance of having the disease. And then there's also the possibility of getting the disease not through genetics, but as the result of a spontaneous mutation. And 4 to 7% of people with PKD have it as the result of a spontaneous mutation. So I think I covered everything I wanted to. I will explain some of the symptoms in further videos. I just wanted to cover the genetic components, so I will follow up in further videos.